Hi there, my name is Marino. I'll be your physical therapist today. Could you tell me your name, please?
Seamus O'Callahan.
All right, and do you know your date of birth?
November 4th, 1994.
All right, perfect. And then, do you know where you're at the moment, Mr. O'Callahan?
At the hospital after my injury.
Okay, perfect. All right, just wanted to clarify some things there. So first, before we get started, I'm just going to go ahead and take your blood pressure. Is that all right?
Yep.
All right, so just go ahead and stay right there. Sorry.
It's okay.
And so, how are you doing today? How's your pain feeling? How's it going?
I'm okay. I'm in a bit of pain.
Yeah, on a scale of 1 to 10, with like 10 being the most excruciating pain possible, and 0 or 1 being almost no pain at all, where would you rate your pain at the moment?
At the moment, it's at a 7.
All right, at a 7?
Mm-hmm.
And at its best, what would you say it's at?
Probably a 5.
All right, a 5. And at its absolute worst?
A 9. It gets pretty bad sometimes.
Okay, a 9 at the worst. All right. So I'll go ahead and take your blood pressure here. All right. And it's a little high, but that's all right. All right. Thank you. And then let me just take your pulse here real quick. All right. And your heart rate and respiratory rate are all right. So from here, we're just going to go ahead and get you seated at the edge of the bed. But first, I'm going to have to roll you onto your side, and then we'll get you seated up together.
Okay.
Is that all right with you?
Mm-hmm.
All right. So what I'm going to have you do is place your arm over here. Is this side all right with you, or would you rather go to that side?
No, this is a better way.
This is the better side? All right. So go ahead, and you can kind of grab onto the table there. And I'm going to, on the count of 3, we're just going to roll you to your side here. Ready? 1, 2, 3. All right. Everything okay?
Mm-hmm.
All right. And then from here, we're going to get you seated up. Are you okay right now?
Yeah.
All right. So if I could put my arm under here. All right. And then I'm going to take your legs. Any pain or anything with this?
No.
No? Okay. So we're just going to come over to the edge, drape them off the side. And then on the count of 3, we're going to sit up together. 1, 2, 3. Good. Perfect. Perfect. Are you all right?
Yes.
Good. All right. So let me, I'm going to take your blood pressure again real quick. Just because I know you've had a little bit of trouble with your blood pressure in the past, and then also with your current condition. We just need to be cautious. All right, go ahead and rest your arm up there. gonna switch sides. And it's just about the same as it was the first time, so that's good. And do you have any dizziness or anything like that?
No.
Yeah? All right. Perfect. Okay. So what I'm going to ask you to do next is, actually, if you could just stay sitting right there, I just want to go ahead and inspect the wound and make sure there's no excess drainage, things like that. Everything looks good. Any pain at the moment other than just that constant 5?
Just that constant.
Okay, cool. And then, yeah, it doesn't look like there's too much swelling or edema. Good. All right, so the next thing we're going to do is I'm going to touch you just like that in just different areas of your lower extremity. Is that all right with you?
Yeah.
And then if you could close your eyes while I do that and just let me know when you feel me touching you.
No. 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 No.
All right, perfect. All right, and so next we're gonna test your upper extremity strength. So if I can see you reach up to the ceiling, please. Good. And then arms out to the side, and then hold them there for me, please. Good. And then out in front of you. Good. Hold them there. Perfect. All right, and then if you could go like this, hold your arms there. Good. Hold them there again. Good. All right, and then I'm just gonna lift your leg up here. Is that all right? No pain?
Yeah, it's okay.
All right, I'll keep it right there. And good. All right, and then we'll do the other side. Keep it right there. Good. All right, you can relax. All right, so actually I want to test your grip as well. So if you could grab onto it with my fingers and just squeeze. Good. Perfect. 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 All right, so what we're going to do next is we're going to transfer you to your new wheelchair. We're going to use this board here just to kind of help slide you over. So I'm going to help you get onto the board, and then I want you to try and use your upper extremity if you can, just to kind of support yourself. Also, you can reach around me. Just make sure you don't reach around my neck. So we're gonna get the board underneath you. Once the board's underneath you, then we're gonna scoot you over to the chair.
Okay.
Is that all right?
Yes.
All right. Make sure this is okay. All right, and then we're just gonna get the board underneath you first. Perfect. All right. All right. And then so on the count of 3, we're gonna just slide a little bit gradually more this way. So 1, 2, 3. Good. And then once again, we're going to slide all the way to the chair. And on the count of 3, 1, 2, 3. Good. All right. Perfect, perfect. Everything okay?
Mm-hmm.
No dizziness or anything?
I'm okay right now.
You're okay right now? Okay. All right, so now we're going to do just another series of tests just to kind of assess your mobility. So what I'm going to ask you to do is cross your arms in front of your chest like that, and then bring your back off against the chair. So just lean forward a little bit, and then I'm going to ask you to sit right there for 30 seconds, or 60 seconds, sorry. All right, good. You can put your arms at your side. Everything okay?
Mm-hmm.
All right, and then we're going to do a reach test. So I'm just going to hold this right here, and if you could reach to this with your left arm. Good. And then reach to it with your right arm. Good. All right. And everything okay?
Yeah, I'm feeling kind of tired. Do you think that I could lay back down?
A little tired? Yeah, we can get you back, sit it back down or lying back down. So same thing, I'm gonna slide the board underneath you. We're gonna rock to the side, slide the board underneath you, get it up, get you on top of it, and then we're gonna slide you back to the bed.
Okay.
So, all right. Good. All right. And then on the count of 3, we're just going to rock up onto the board. 1, 2, 3. Good, perfect. And again, 1, 2, 3. Perfect. Just like that. All right. And you can get situated how you want there. Good. And then I'm going to help lie you back down. We're just going to get you back on your back here. So on the count of 3, we're just going to lie back down on your side, and then I'll help roll you back onto your back.
Okay.
So 1, 2, 3. Good. And then we're just going to roll back here. Good. All right. Good. Everything okay?
Mm-hmm.
Are you comfortable?
Mm-hmm.
All right. So we're going to take your blood pressure one last time before I head out here. Perfect. And then I'm also going to leave you with this questionnaire. It's called the Activity Specific Balance Confidence Questionnaire. So it's a self-report questionnaire where it's going to kind of tell me how confident you are in your balance.
Okay.
All right. All right, good. No issues there. Perfect. And I'm going to leave the call bell within reach if you need anything. And then again, going to leave this questionnaire here for you. Then I'll see you tomorrow.
All right. Thank you.
Thank you.